For more anatomy-related videos, please subscribe to my channel, Learn with Dr. Tanya Hashik.
So today we will discuss about heart. That is the anatomy of heart. Here I am only giving you an introduction to the anatomy of heart. We will go in detail in the upcoming sessions. So heart is placed obliquely in such a manner that 2/3 of it is located towards the left of the median plane and the 1/3 is located towards the right of the median plane. So heart, where is it located? You can see that heart, it is located in between the two lungs. That is the right and left lungs. So the space between the two lungs is the mediastinal space. So heart is located in the mediastinal space. Again, this mediastinal space is divided into superior mediastinum and also inferior mediastinum. So you can see that heart is located in the inferior mediastinum. And this inferior mediastinum, it is again divided into anterior mediastinum, middle mediastinum and also posterior mediastinum. So when you say the exact location of heart, it is located in the middle mediastinum. So heart is a conical shaped organ and it pumps 70 ml of blood during each contraction. And there are about 1,08,000 contractions in a day. So this muscles, it is very efficient in contraction. So in an athlete, the muscles are more developed and they can effectively pump blood to the whole body. So doing cardiac exercises makes your heart move stronger and it helps to effectively pump blood to the whole body. And in males, it weighs up to 300 grams and in females, it weighs up to 250 grams. So the heart, it has got 4 chambers. That is the left and right atrium and the right and the left ventricle. So on the surface, the 2 atria are separated by means of interatrial groove and the 2 ventricles are separated by means of interventricular groove. And the atrium and the ventricle, it is separated by means of atrioventricular groove. It is also called as the coronary groove or the coronary sulcus. So heart, it has got an apex which is directed downwards, forwards and to the left. In this figure you can see the apex. This is the apex of the heart and it is directed downwards, forwards and also to the left. And it has got a base. So this is the base of the heart. You cannot see it completely as it is directed posteriorly. So it is also called as the posterior surface of the heart. And it has also got an anterior surface. So this is the anterior surface and it is also called as the sternocostal surface. And it has got a lower surface and it is the inferior surface or the diaphragmatic surface. So below which is the diaphragm. And it has also got a lateral surface. So this is the lateral surface of the heart and this is the left lateral surface. So these are the surface of the heart and it has got 4 borders, an upper border, an inferior border, a left border and also a right border. So an upper border, an inferior border, a left border and also a right border. So these are the 4 borders of the heart. So the heart, it is separated from the other structures of the thoracic cavity by means of a covering called as the pericardium. So pericardium, it covers the heart as well as the base of major vessels also. So it has got 2 layers, that is the outer fibrous layer which is a tough layer and also an inner serous layer. So this serous layer, that is the inner layer of pericardium, it is again divided into a parietal layer which is fused with the fibrous layer and also a visceral layer which is fused with the wall of the heart. So in between the parietal and visceral layer of the serous pericardium lies the pericardial fluid. So heart, it is covered by two layers, that is the fibrous layer and also a serous layer. So the serous layer, it is again divided into parietal layer and also visceral layer, and in between the parietal and visceral layer is a pericardial fluid. So we will discuss each of this in detail in the upcoming videos. So heart has got four chambers, that is the right atrium, right ventricle, left atrium and also left ventricle. So the deoxygenated blood, it is carried by the superior vena cava and the inferior vena cava to the right atrium. The superior vena cava, it carries blood from the head, neck and also upper limb, and the inferior vena cava, it carries blood from the lower limb. So these deoxygenated blood, it is carried to the right atrium and it reaches the right ventricle through the tricuspid wall. So from the right ventricle, it is transported to the left and right lungs by means of pulmonary artery. So here you can see that artery carries the impure blood, that is the deoxygenated blood. This is the only place where artery carries the deoxygenated blood and also the veins carries the oxygenated blood. So in the left atrium, the pulmonary vein, it carries the oxygenated blood from the lungs and it reaches the left atrium. And from the left atrium, it reaches the left ventricle through the bicuspid wall. And from the left ventricle, it is pumped to the whole body by means of aorta. So in this figure, you can understand that the wall of the atrium, that is the two right and left atrium, it is thin, and the wall of the ventricle, it is thicker. So we will discuss each of these topics in detail in the upcoming videos. This is the end of today's video.
This is the end of today's video. For more videos, please subscribe to my channel and press the bell icon.